Okay, hello everyone. Thank you for joining our webinar today. We are talking about treatment options for women with fibroids, including the Sonata treatment. And we are very happy to have Dr. Shashoua here with us from the Chicago area. And we will be putting a link into the chat to be able to schedule a consultation with Dr. Shashoua at his location. Good morning, Dr. Shashoua.
Hi, good morning. How are you?
Good. So we're going to get started. If you'd like to just tell me when to advance to the next slide, I will do that for you.
All right. Well, thank you again. This is a subject that's near and dear to my heart. Fibroids are the majority of what I do in our practice here in Chicago. And I'd like to share with you some exciting new treatment options available for women with fibroids. So what are fibroids? We're going to go through that. They're basically muscle tumors of the uterus that can cause a variety of symptoms. They're very, very common. But depending on the location of the fibroids and the size of the fibroids, that pretty much determines whether patients are going to have symptoms. So the complicated thing about fibroids is that you can have a very large fibroid and have very minimal symptoms, or you can have a relatively small fibroid and have crazy symptoms. And it really depends on the location of the fibroid when determining what kind of symptoms patients are going to have.
And
Excellent.
Dr. Shashua, a common question that we hear from patients is asking if fibroids are cancerous.
Uh, we hear that all the time too, and for the vast majority of patients, cancer is not an issue that they need to worry about. By definition, fibroids are benign tumors. Now, there are cancers of the uterus that we think about when we're doing imaging and when we're discussing things with patients. But once you've hopefully determined that you have a benign fibroid, that by definition is not cancer. So some of the symptoms, depending on the location, like we talked about, some mucus fibroids are fibroids that are in the cavity of the uterus or near the cavity of the uterus, and those typically cause heavy bleeding. They don't need to be very large to cause heavy bleeding, and so that's something that's interesting. You can have a very small fibroid that causes crazy bleeding. Intramural fibroids are fibroids in the muscle of the uterus that can cause symptoms of bloating and also abnormal bleeding. Frequency is a urinary frequency, or having to go to the bathroom often is another symptom that women get. And then with very large subserous fibroids, women can get symptoms of bloating or even feeling like they're pregnant. We've had patients come in who thought they were 9 months pregnant and really just had fibroid tumors. And so, if you're being told you look pregnant on occasion, you may want to look into that as well. So some facts about fibroids: nearly 70% of white women and a large percentage of Black women have fibroids before the age of 50. Not everyone experiences symptoms, but depending on the size and location, about 20 to 50% of women experience symptoms. More than 2 million women each year undergo a treatment for uterine fibroids. And there is a genetic propensity for fibroids. So if you have a family history of uterine fibroids, it's much more common for you to have fibroids in your own history.
And Dr. Shashua, are fibroids able to come back? So if you treat a fibroid, can it regrow?
So that's a great question. When we remove fibroids, those fibroids don't come. The ones that we remove are not going to come back. But women are at risk once they develop fibroids for developing recurrent fibroids or having new fibroids come back. And so that's something. Once you have surgery for fibroids, you're at about a 20%, 30% risk of having a second surgery for fibroids if you have decided not to have a hysterectomy. So how do you know if your symptoms are caused by uterine fibroids? Well, like we talked about, heavy bleeding, prolonged bleeding, if you're missing work due to bleeding, if you're changing your clothes, if you're using tampons and pads, if you're changing pads every hour, those are all symptoms of very heavy bleeding and bleeding really that you should get treatment for. So sometimes on examination, we can suspect fibroids. But I hear way too often that women go to their doctor with severe symptoms, either of pelvic pain or of heavy bleeding, and the exam is normal, and they're told that their exam is normal without any other imaging. And the important thing is that if you're experiencing these symptoms of heavy menstrual bleeding or pain, the first step really after examination is getting a pelvic ultrasound to evaluate. And so pelvic ultrasound is the mainstay diagnostic procedure that we use for fibroids. We also sometimes will use MRI in cases that are a little bit more complex. Oh, it's right there. There it is. Further confirmation. It's talking beyond the slide, but yeah. Next slide. So many women wait years to see, and this is the frustrating part when we're seeing patients in the office. Women go to emergency rooms on multiple occasions. They may receive blood transfusions, iron infusions, a variety of different treatments, and many women spend a significant amount of money on both sanitary products and other treatment, like alternative treatment options that are marketed online. And it's interesting that many women go years doing this. And so unfortunately, many of those supplement or alternative treatments have never been really shown to scientifically change outcomes for fibroids. And so it's important when you're talking, if you're having these symptoms, see a physician who is able to kind of offer all of the wide variety of real medical treatment options for you to get treatment. Women wait an average of 3.6 years, 32% wait more than 5 years, 79% say they don't want invasive surgery and long recovery times. And a common misperception on the physician's part, and I see this all the time when speaking to physicians, is that, well, just take it out. Why wouldn't you just take it out? And why wouldn't you just have a hysterectomy? And the reality is many women want to preserve their uterus, either for fertility, but in some cases because it's part of their womanhood and they feel it's important to keep. And so we'll talk through different options that are available for women who don't want a hysterectomy. So what are some of the fibroid treatment options? You should know you have choices, and there are definitely, even in the last 5 years, the number of choices has grown exponentially. So we'll talk about that. There's medical and hormonal therapy. There are a couple of new drugs on the market now, specifically aimed to treat fibroids. So birth control pills typically were used to control heavy bleeding, but now there are drugs specifically for uterine fibroids that can decrease fibroids. And the point of those medications are to dial back your estrogen level to a level where the fibroids aren't being stimulated. And so in many women that we see, they're being placed on birth control pills, changed birth control pills, tried a number of different progesterone treatments. If those are not working for you, there are definitely other medical options that can be discussed as well.
And a common question that we hear on the medication treatment is asking us if the fibroids stop growing while you're on the birth control pills.
No, and so that's important to remember. So the birth control pills are meant to control the symptoms of heavy bleeding, but they're not going to make the fibroids go away. They're not going to make them shrink. There's conflicting data whether they actually make them grow. And so it does make sense for some women to try birth control pill to see if the heavy bleeding is not necessarily being caused by the fibroids. But if you're having heavy bleeding that is from the fibroids, birth control pills, the IUD, those options may not be the most effective options for you. We'll go to hysteroscopic myomectomy, and hysteroscopic myomectomy is the ideal procedure if it's something that you're a candidate for. Those fibroids are fibroids that are in the cavity of the uterus that can be removed with a camera inside the uterus. It's a minimally invasive surgery. There's no incisions. It's an outpatient procedure with minimal recovery. The problem is that most women do not have a fibroid that can be managed with hysteroscopy. And so that's where the imaging, preoperative imaging comes in place. I see a lot of patients who have a fibroid and have had 3, 4, 5 hysteroscopic myomectomies that attempt to remove a fibroid that's either just too big or not in the correct location to be removed hysteroscopically. So that's the important distinction of whether a fibroid, the location and the size, are really important to determine whether you're a good candidate for hysteroscopic myomectomy. Uterine artery embolization is a procedure that we use in some cases that is non-surgical, although it is a procedure and it's not without its own issues. Basically, in uterine artery embolization, the radiologist accesses the arteries that are going to the fibroids, either through the leg or through the arm, and places plastic particles into those arteries and hopefully preferentially blocks the blood flow to the fibroids. Over time, those fibroids will shrink and hopefully cause less symptoms. A couple of issues with uterine artery embolization is that the plastic particles can migrate to other places. So there are reported cases of infection, ovarian failure, rare, but those are risks of the procedure. It's also important to remember uterine artery embolization, while it's minimally invasive and marketed as not surgical, it's not painless at all. In fact, we hospitalize patients overnight for pain, and usually patients experience a significant amount of pain as those fibroids, the blood supply has been cut off to those fibroids. And so there is a recovery period after uterine artery embolization, and long-term studies show there's about a 30% risk of needing hysterectomy, not necessarily because of the procedure, but because of continued symptoms after uterine artery embolization. And then myomectomy is surgical removal of the fibroids. That can be done either through a small bikini incision or through laparoscopy. We do this a lot of times for preservation of fertility because it is the one procedure that has significant information regarding pregnancy outcome after it. General anesthesia is required, and it is a little bit, even laparoscopically, the recovery is a little bit more significant than other options that are available. And so it's a very effective treatment for removing fibroids, but you have to remember also that new fibroids can form. And that's a frustrating thing for patients. They undergo a pretty major surgery, and then 3 to 5 years later, they have recurrent symptoms of fibroids. So the goal of myomectomy is to create a window of time to preserve fertility and to try to get pregnant. And it is an effective treatment that we do multiple times a week, but it has some downsides as well. Then hysterectomy is an option, and I think, in full disclosure, if you look at long-term data regarding hysterectomy, patients are happy. So in general, the patient satisfaction after hysterectomy is very positive. And that's why it's one of the most common medical procedures done. But like we talked about before, it's not without risk. It carries a longer recovery time, and many women don't want hysterectomy for a variety of reasons. And so because of that, there are a number of different options that are available. Next slide. If you want to talk anything more about hysterectomy. So the hysterectomy can be done laparoscopically as an outpatient procedure or a one-day surgery. Patients generally go home and have discomfort for about a week after a laparoscopic hysterectomy, and then a couple more weeks of just recovering. There is an incision in the vagina that needs to heal that has you refrain from intercourse for 8 to 12 weeks after that procedure.
And something that we're often asked, Dr. Shashoua, is if hysterectomies make a woman go into menopause.
That's a good question. So hysterectomy the uterus is a separate organ from the ovaries, so the ovaries are left usually in place in a hysterectomy. That wasn't true 20 years ago. Most hysterectomies 20, 30 years ago were done with removal of the ovaries. But there's data now showing that it's really important to leave the ovaries at hysterectomy. Even if you leave the ovaries, however, there's also some information showing that the ovaries decline in function a little bit more rapidly after hysterectomy. It's not dramatic, and in practice, we don't necessarily see it, but when you compare the two groups of patients, it seems as though women who undergo hysterectomy, even with the ovaries not removed, may go through menopause a little bit earlier than those women who haven't had a hysterectomy.
Thank you.
So the reason why we're here is to discuss the Sonata treatment, which is an exciting new treatment for treatment of fibroids and heavy menstrual bleeding. It's available, but not only is it available, it's being covered very well by insurance companies because of the success of the treatment. There is no incision. The procedure preserves the uterus and doesn't involve removal of any tissue. It doesn't require general anesthesia or an overnight stay in almost all cases. So we're going to show you what that procedure is about in this short video, right?
Yes.
Okay.
The innovative Sonata system combines real-time intrauterine ultrasound with radiofrequency energy to provide an incisionless, uterus-preserving treatment for women with symptomatic uterine fibroids. The Sonata treatment device is inserted through the vagina and cervix and into the uterus. The intrauterine ultrasound probe allows the physician to survey the uterus and locate fibroids. The physician uses the intrauterine ultrasound probe to target specific fibroids. Graphics are displayed on the ultrasound image to guide the operator. No manual measurements are required. The red ellipse represents the ablation zone, and the green ellipse represents the thermal safety border. The thermal safety border must stay within the serosa at all times during the procedure. The operator adjusts the size and depth of the ablation zone using the purple joystick on the handpiece. The introducer is advanced to the center of the fibroid, and the operator uses the purple joystick to align the smart guide to the introducer. The treatment device is rotated to confirm safety. The physician confirms that the thermal safety border is within the serosa using the gray button on the handpiece. Needle electrodes are deployed into the fibroid, and the treatment device is rotated again to confirm safety. Radiofrequency energy is delivered. Ablation times range from 1 to 7 minutes depending on the size of the fibroid. The needle electrodes and introducer are retracted to allow for additional ablations or removal of the treatment device. 50% of women return to normal activity by the next day. The ablated fibroids shrink over time, and most women experience a reduction in symptoms and heavy menstrual bleeding within 3 months.
So we'll talk a little bit about the safety information as we go forward, but so the fibroid that was depicted, it was a submucous fibroid, but it wasn't a fibroid that can be removed hysteroscopically because it was only partially in the cavity of the uterus. So this treatment is very effective for that type of fibroid in particular. Next slide. So it has, while it's a relatively new treatment in the United States, there's a large number of patients who've already been treated in the United States and Europe. And there's a number of articles that support how effective the treatment is. Next slide. So what can you expect? And the one of the studies that was performed prior to approval followed patients out for 3 years. So what can you expect? Well, 50% return to normal activity in the first 24 hours. So that's kind of amazing, right? It really is a procedure that is done, and within a day or two, the patient's feeling pretty normal. There may be some discharge associated with the procedure, but the symptoms are usually very mild. 95% of patients had a reduction in menstrual bleeding at 12 months. So not only did it work for the first 3 months, it worked for 12 months, and then also continuing to 3 years, 94% of patients were satisfied. While it's not 100%, there's no procedure in medicine. You have to remember, no procedure has a satisfaction rate much more than 90%. So 94% is a very robust percentage for women who are satisfied after the procedure. And then 88% report improved symptoms even at 3 years. So it's a procedure that compares very favorably, if not better, than even removing the fibroids. And so, and with an outpatient approach and with a minimal recovery. Next slide. So if you are interested in treatment, there's a number of different options. One way is to scan the QR code, which I don't see up there.
Yeah, we'll provide the QR code and the clickable link in the
And
graphic of the video.
And then the Sonata treatment, you can also look on our website, fibroid.com, FIBROID.com, for information, or sonatatreatment.com. And, you know, just as a final thing, nothing is without, there's a decision-making to everything, right? Decision-making process to everything. And you really need to find a procedure that fits your particular case. And the important thing I've learned is to find a physician, hopefully locally, local to you, that is knowledgeable about a number of different treatment options. And one good thing to know, a little side secret, is that if you go to the Sonata treatment website and find a physician near you, not only is that doctor going to be knowledgeable about the Sonata treatment, but those doctors particularly are ones that are knowledgeable about fibroid treatment in general and all the different treatment options, including minimally invasive hysterectomy, myomectomy, and other treatment options that are available. This procedure kind of selects for the physicians who do a significant amount of fibroid treatment and work. And so if you're looking for someone near you that may be familiar, that's a good resource to find, and don't feel like you're just limited to Sonata. These doctors really, by definition, treat fibroids with all the available methods of treatment.
Thank you very much, Dr. Shashoua, and thank you for offering Sonata as well as all treatment options to women to see what works best for each woman to take care of her fibroids. Again, as he mentioned, you could go to sonatatreatment.com and there will be links to schedule a consultation with Dr. Shashoua or other physicians across the country. And in your email, there will be a clickable link specifically to Dr. Shashua's webpage to schedule a consultation directly through him as well. Thank you very much for your time. If we get any questions that come in, we'll be sure to send them your way. And if anyone else has questions, please send them to us and we'll make sure that we get them to Dr. Shashoua.
All right, thank you very much.
Thank you.